Hey, this is Dr. Tom Rogers. A quick note about today's podcast. In today's podcast, I talk about eating less grains, not more grains. I even talk about the dangers of eating a lot of vegetables. So it kind of goes against conventional wisdom. That's one thing I like to do is challenge conventional wisdom, especially when that wisdom is old-timey and not working for a lot of people. So people are different, but today's podcast is going to be very interesting for you. Controversial maybe, but a lot of times when I look at people's guts, I look at their weight, I look at their fatigue, I look at their diseases and things, conventional wisdom just isn't working for them sometimes. So I came upon, but it was suggested that I read this book. And that's kind of one thing that led me to do a deeper dive on why eating more whole grains may not be so good for you. It's How to Heal Your Metabolism by Kate Deering. It's a really good book that kind of challenges a lot of the conventional wisdom. I don't agree with everything in this book, but there's a lot of great points in it. And for those of you that are struggling with your metabolism and your gut, you really need to look at this book and listen to my podcast today on whole grains and vegetables and fiber, because it may be going against you. I've been a long-time subscriber of Mark Sisson's Mark's Daily Apple. He's the one that wrote the Primal Blueprint, and he's been kind of a nutritional hero of mine for many years. And he'll say the same thing that she's saying here about grains. He thinks grains are just a total no-no, and that's what we're kind of evolving towards. But the grain industry is huge. It's cheap. It's everywhere. It's subsidized. So there's a lot of reasons why we produce so much grain. It's unbelievable, and it's been a staple of the American diet and really becoming a staple of the worldwide diet. So listen to the podcast today, and I challenge you to kind of do your own research, do a lot of reading, and then do what works for you. If you're healthy as you can be and your gut's fine, your weight's fine, your energy levels are fine, you're probably doing okay. But remember, not everybody's the same. And as I see patients every day that struggle with this, I try to take a real deep dive and look outside the box on some of these things. So I think you'll enjoy today's podcast. Do your own research. I'll see you next week. Hi, this is Dr. Tom Rogers at Performance Medicine, coming to you with a weekly podcast of the Common Sense MD. Now, today I'm going to challenge you a little bit. I'm going to challenge conventional wisdom because I love challenging conventional wisdom, especially when the conventional wisdom is wrong. And there's a lot of stuff that we have challenged that's been wrong, a lot of stuff that people tell you, doctors tell you, and especially in the realm of nutrition. So today I'm going to tell you to eat less grains. Now you heard me right, eat less grains, even less whole grains. We're told by 99% of nutritionists and doctors, etc., to eat more whole grains. But really, when you take a deeper dive into it, that's really not good wisdom. I mean, look at what's happening with our country nutritionally. So I'm going to tell you to eat less grains, and I'm going to tell you why. What is a grain? A grain is a hard, dry seed. Although legumes are termed grains, we're going to consider today just the cereal grains, which are grains that are really seeds of grasses. I'm talking about wheat, corn, barley, rice, quinoa, oats, millet, rye, buckwheat, and sorghum. These grains are starchy carbohydrates. They consist of many glucose molecules banded together. That's why they're called polysaccharides. They're staples of the American diet for a reason, because they're cheap and because they're subsidized by the U.S. government, and they're easy to transport, have a long shelf life, and they're packed with energy, i.e. calories. That's why we're getting fat as a country. One reason. Big food giants produce thousands of cheap grain-based food products, and Americans are getting bigger because of it and more unhealthy because of it. One problem with these cereal grains is that they have a high glycemic index. The carbohydrate portion of these grains is 100% glucose. That means on the glycemic index, how long it takes your blood sugar to rise after you eat something a couple hours later, it's 100, as high as it gets. For example, the glycemic index on table sugar, which is sucrose and fructose, is like, I think it's 57. So it's a lot lower than the glycemic index of glucose. So starches from grains like white and wheat bread. I mean, you think about white and wheat bread, there's not a whole lot of difference, really. They both have a higher glycemic index than sugar or table sugar. So also think rice, corn, oats. They all have a high glycemic index. In other words, they're going to raise your blood sugar. Your insulin's going to pop up. You're going to get it stored as fat, and you're going to want to crave more carbohydrates. Remember, one of my things for people that need to lose weight is eating less carbohydrates and more fats and moderate proteins. Again, you have to eat the right kind of foods, and everybody's different. Everybody's gut microbiome is different, so you have to consider that in this talk. Another thing, a big thing, is that grains are seeds, and seeds are filled with anti-nutrients. Remember, plants don't want to be eaten. Fruits do because they're eaten and they're digested and then they're excreted and they grow. But most plants do not want to be eaten, so they have all these stuff on them that deters animals from eating them, like oxalates. Oxalates bind calcium. Think kidney stones. Phytates, they block zinc, copper, and magnesium, very important minerals. Lectins, you've all heard about lectins. Those are carbohydrate binding proteins found in plants, seeds, legumes, grains, and nuts. These lectins interfere with the mucus repair of your gut lining. Besides grains, the worst offenders of lectins are legumes, beans, and soy. Soy's terrible. And many vegetables also, believe it or not. Glutens, that's another bad thing that plants and these seeds have on them. You've already all heard of this dirty word called gluten. Gluten is really a storage protein in all grains, including oats, corn, rice, and quinoa. They all contain a form of gluten called prolamines, besides glutens, which are from wheat, rye, and barley. So glutens are very hard to digest. They can cause a lot of bacterial overgrowth and intestinal permeability, which allows toxins and undigested food particles and bacteria to leak through the intestinal walls into the bloodstream, where it can produce an immune response that the body will start attacking these proteins. And that's where you get autoimmune diseases that we find so common nowadays. So, you don't have to have celiac disease to have a gluten problem. At least a third of us, in my opinion, have a gluten problem, probably more than that. And celiac's just 1%. That's a really severe form of gluten intolerance. And those people, the only cure for that is just totally avoiding gluten, which is hard to do because they stick it in everything as a filler. But remember, just because it's gluten-free doesn't mean it's good for you. It's still going to be bad carbs in a lot of things. So people that have gluten sensitivities have a lot of symptoms of celiac, just milder, like fatigue, diarrhea, brain fog, skin rashes, joint pain, bloating, gas. So if you think you have a grain problem, and you probably do, try giving them up for 30 days. It generally takes about 30 days for something to really work its way out of your gut, and you can rebalance that gut microbiome and start eating some foods that you're not going to be intolerant to. So good grains for healthy people include organic white and jasmine rice, organic slow-cooked oatmeal, and sourdough bread. Sourdough bread is really the only form of bread I'll eat anymore. So it can be pretty good for you, really. It does have some carbs in it, but it seems to be digested a lot better. A lot of this depends on what your digestive system tells you, and people are so different. You've also been told to eat more vegetables. I mean, everybody says that. And it's true that they have a lot of nutrients, fiber, and antioxidant properties. But leafy greens that are grown above the ground, these types of vegetables, they also have a set of toxins to deter animals from eating them, like lectins and lignans and PUFAs and cellulose. Actually, to help me diagnose IBS, which is really diagnosis of exclusion, I'll have somebody go eat a salad, and if they tell me they can't tolerate a salad, they probably have IBS, irritable bowel syndrome, so they have a problem with this. So is more fiber good for you? That's something else we tell people, eat more fiber. Well, in a lot of these people, more fiber actually makes it worse. It makes you produce more gas, and more fiber in an unhealed gut can lead from IBS to ulcerative colitis to Crohn's, maybe even to colon cancer. So that's another misnomer. More fiber may not be good for you, just like more whole grains may not be good for you at all. Many vegetables, like another thing you hear about, eat cruciferous vegetables, like, things like broccoli and cauliflower and things like that. They can be goitrogens. Now, what a goitrogen is that means they really suppress your thyroid function, especially in people that are prone to thyroid dysfunction, which is about a third of us, especially women. And soybeans, another goitrogen that you want to avoid. It's very estrogenic as well. Bok choy, cabbage, Brussels sprouts, cress. You need to cook these cruciferous vegetables. So they can really cause a lot of problems with your thyroid. But generally, if you cook them, they're not so bad for you. So when you hear dietary advice given out that we've given out for years, I've done it myself. I've made these mistakes because that's what I was taught. So when you hear a lot of this old dietary advice, you really have to think twice about it. People are different. Your gut microbiome is different. That's why you need pre and probiotics. The food industry adds all kinds of ingredients that aren't good for you. I mean, I haven't even touched on them here today. I'm just talking about mainly grains and goitrogens and things like that can irritate your gut and lead to poor health and malabsorption. So my best advice is, if you're overweight and you're tired and you're bloated and you have abnormal bowel movements, you're pre-diabetic or diabetic, you need to start thinking about changing the type of diet that you eat and rethinking some of these things that are conventional wisdom, like eat more grains. I really don't think you should be eating more grains for the most part. And I know a lot of nutritionists are going to get on me for this, but really, I don't care. I can give you the literature that can prove it. And, I talk to thousands of patients, and, I'm a patient too. I know I do not tolerate grains, definitely don't tolerate glutens very well. And when I increase my fiber to try to eat a lot more fiber, it just makes things worse for me. Now, for some people, it may be okay. And there's certain good things about fiber, but there's a lot of things too in certain people's guts that it makes it worse. So when you hear people say, eat low fat, don't eat salt, eat more grains, and maybe eat more veggies, think again if this is not working for you. Thank you. This is Dr. Tom Rogers, Common Sense MD. I'll see you next week.